Hello and welcome to Doctor's Orders at the Chrissy B Show. I'm Dr. Rob Hicks. Today we're going to be talking about the prostate gland. This is a gland that men have that starts life about the size of a walnut, and its job is to provide the liquid that carries and nourishes sperm. But over the years, for some reason, and nobody really understands why, the prostate gland can increase in size. And because of where it's located in the body, it sits below the bladder and is wrapped around the urethra. That's the tube that connects the bladder through the penis to the outside. It's where urine flows through to actually get to the outside. When it enlarges, it can cause pressure on that tube, rather like putting a kink into a hose pipe. And so that affects the flow of urine. Now, the sort of problems that affect the prostate, there's the enlargement called benign prostatic hyperplasia, or BPH. This is the natural enlargement of the prostate that occurs as a man gets older. There's also prostatitis, which is inflammation of the prostate gland. And of course, as you are probably well aware, there's prostate cancer. So as the prostate presses on the urethra, that tube that carries urine from the bladder to the outside, it can interfere with the flow of urine. And many men describe having to get up frequently at night to pass urine. During the day, they find they need to pee more often than usual, and often they have to really race to get to the toilet in time, sometimes not actually making it. They also find that when they do get to the toilet, it takes a little while for the urine to start to flow, and actually that flow, that stream, is not as strong as it might have been in their younger days. And then of course they zip up, they wash their hands, they walk away from the bathroom, and then they feel they need to go to the toilet again. So these are the common symptoms that the prostate can cause when it's getting bigger and pressing on that tube. With regards prostatitis, inflammation of the prostate, what men often get is pain when they pee, having to pee more frequently, but also pain in the pelvis, around the genitals and around the buttocks, and the area beneath the scrotum and the anus, an area of skin called the perineum. Now, thankfully, there are ways to overcome prostate problems if you are suffering. So with regards to lifestyle, there are some changes you can make. For example, don't drink too much fluid in the hours before you go to bed. And certainly don't have things like caffeine or alcohol, because actually they'll make you want to pee more. And when you do go for your last pee of the night before you go to bed, wait 5 or 10 minutes afterwards and go back and try and pee again, because that way you can empty your bladder as much as possible so that there's less urine in the bladder to cause you problems overnight. So as far as prostatitis, the inflammation of the prostate is concerned, that can be treated with painkillers and antibiotics. With enlargement of the prostate, the BPH, then there are medications available that can shrink the prostate and indeed relax the muscles, again enabling the urine to flow more freely and reduce the risk of a man suffering the symptoms. There's also an implant that can be put to pull the prostate back to relieve the pressure on the tube where urine flows through, and of course there's surgery to reduce the size of the prostate, again to increase easy urine flow. With regards to prostate cancer, treatment really much depends on what type of cancer it is and how much it's developed throughout the body. Now, it's very important not to be embarrassed if you've got a prostate problem, and to make sure that you get in control of your prostate rather than letting your prostate control your life. So if you've got a problem with your prostate, or you know somebody who's got a problem with their prostate, please seek your advice and help from your doctor, because this is a problem that can be effectively overcome. And that's Doctor's Orders.